as many of you know, October is Breast Cancer Awareness Month, and here at Local on 2, we are working hard to bring you informational and inspirational stories throughout the entire month.
That's right. And today we want to start by talking to Dr. Abramson. She's from Vanderbilt-Ingram Cancer Center. Thank you so much for being here. Unfortunately, everyone is touched by cancer in some way. Now, specifically, breast cancer. How prevalent is it right now?
So unfortunately, it's very common. Breast cancer is actually the most common cancer in women in the United States. It's about 280,000 new cases per year and about 40,000 or more deaths per year in the U.S. alone. So it's hitting us hard. You know, we always hear the statistic 1 in 8 women will develop breast cancer. It's true. The lifetime prevalence is about 13%. And the median age is 62, so about half of the people who are diagnosed will be older than 62, but the other half will be under 62.
What are, you know, we hear all the time, this is good for you, this is bad for you, and sometimes it's the same exact thing, and you don't know what to do anymore, sorry. What are some preventative measures that you like to tell people?
Well, the first one, the easy one, is go get your screening mammogram. It's not so easy as it sounds, though. I think people have a lot of barriers and a lot of anxiety about getting their screening mammogram, but I'm here to tell you it's important and it saves lives. The other thing is to be really aware of your own personal circumstances and also a little bit about your own family history. So, for example, if you have somebody who was diagnosed with breast cancer under the age of 40, or somebody in your family who has ovarian cancer, that's important, and that's something that needs to be communicated to your physician. They might recommend different types of screening. They might recommend genetic counseling. You know, there are other things that they might take into account there. And beyond that, the other things that people can do, exercise. So exercise, actually 30 minutes a day of brisk walking, 150 to 300 minutes a week or so is really, really important. That, just a healthy weight. We know obesity is certainly linked to breast cancer. So if you can maintain a healthy weight, you're doing yourself a big favor, not just for breast cancer, but for heart disease too.
Yeah.
Go ahead.
I was just going to say, a good friend of mine turned 40. She went for her first mammogram and they found breast cancer, so she's undergoing treatment. And I keep hearing about 20-year-olds, 30-year-olds, you know, 40, 41-year-olds that are getting breast cancer. Are you seeing it younger, or are we just hearing more about it?
I think it's a combination of both, but we certainly know that there is a trend towards younger people getting breast cancer. And the reasons for that remain pretty unclear. We know that there are certain links. We know that menses are occurring earlier, and we know that more estrogen exposure leads to higher rates of breast cancer. Why menses are occurring earlier? We know that there's some link to obesity there, but there are other factors at play as well. So we are seeing these trends, and what's really causing them remains unclear. But I do want to add, one thing is, and I think this is important for people to know, is that about 75 to 80% of people diagnosed with breast cancer have no family history, and the vast majority have no discernible risk factors. They are shocked when they're in our office. They're the first to say, well, but I've done everything right and I have no family history. I don't understand.
Wow. We do want to make sure we end on a good note. You do have some good news to tell us about all of this.
Yes, I do. There's certainly a lot to be grateful for. So, you know, with all the screening awareness, people getting screening access, and the new treatments, we're seeing decreasing rates of death from breast cancer decade by decade. In fact, if you're diagnosed with breast cancer today, you're very likely to be cured of the disease.
Wow.
And
it's just amazing. Modern medicine.
It's
beautiful. It's beautiful. Thank you so much for being here, Dr. Abramson. You are amazing. For more information, go to vicc.org.